Okay, thanks, Steve. This is the first time we've actually had somebody from a pharmaceutical house here, I think, at our symposium. So if there are questions, pharmacy questions, medical device questions, these are all things that, we haven't directly addressed in the past. And I think now that we have somebody, that can speak to these issues, if you have questions, make sure you write down all your questions, hold them up, and I think we have people coming up and down the outside aisles to pick up those questions for the Q&A at the very end. Okay. On the stage today is the CEO of the Institute for Healthcare Consumerism, Mr. Doug Field. Through building the Institute for Healthcare Consumerism, which is a collaborative environment that connects various parts of the industry, Doug has been a significant leader in the movement toward greater consumerism. He brings meaningful multimedia content to readers and a valuable social network platform to various stakeholders. In fact, he's molded the Institute for Healthcare Consumerism into the only multi-platform, collaborative environment focused exclusively on innovative health and benefit management. Today, Doug's going to explore the evolution of employee benefits. Mr. Doug Field.
Good morning. Well, if you're not overwhelmed now, you will be in another 15 minutes. I feel for every small business person out here, or mid and large size business. It's just a lot of dynamics in this marketplace, and much of it has nothing to do with the ACA as well. There's been a pent-up demand for this market to change for a long time, and the time is now, and the ACA has become somewhat of a catalyst for that. But some of these trends started a long time ago. David gave a brief overview. I'm not going to spend a lot of time here, but we have built an information hub and collaborative community focused on healthcare consumerism, which I'll define here in a minute. And this addresses a trend that started back in 2002, and in 2007 I looked at this marketplace and saw some changes taking place way before the ACA, and was very fortunate to have a meeting with Newt Gingrich and his senior health policy advisor, who at the time Newt was running the Center for Health Transformation, and I told him about my idea, about what I identified as healthcare consumerism trend, and he looked across the table, and whether you agree with Newt's politics or not, he's a very smart guy, and he said, healthcare, they had identified healthcare consumerism as a very legitimate mega trend, and that's what we moved to fulfill, is to start pulling this industry together and address healthcare consumerism as a mega trend. And mega trends succeed in markets regardless of economic factors, and we had the worst recession in our lifetime, political elements, the whole ACA debate, the stalemate, the waiting until the Supreme Court decision was made, and then the election. But finally, we're on the other side, and aside from the ACA challenges that it gives all of you, healthcare consumerism is moving forward, and healthcare consumerism is very simply about transforming an employee health and benefit plan to one that places shared responsibility with your employees and their families. Some people call it cost shifting. I call it shared responsibility. And it goes a step further, because the smart employers, whether you're a small business, a mid-size, or larger business, are one that puts tools in the hand of your employees and their families to help them become better educated consumers of health and healthcare. The other key element with healthcare consumerism is, for the first time, you see all constituents gathering around the consumer to help the employer, and I'm primarily talking about employer-sponsored healthcare here, although it goes out to the individual market. All stakeholders, from payers to providers to advisors like Rob and his team, to consultants, to solution providers, to health plans, gathering around for the first time with a focus on the employee and their families and building the right programs and putting the right programs in place for the employees and their families. It has a lot of different moving parts, and I won't get into all of them, but it's not just about the health plan. You know, it's about transparency, access to right care, right price. It's about the emergence of direct primary care networks. It's about the development of a lot of consumer decision support tools that I'll talk about in a minute. Specialty pharmacy, big concern in the marketplace, as was just previously addressed. So this market has a convergence taking place, aside from the ACA, which is very major, and that's the influence of consumerism that I just outlined, and technology. Technology has found its way into this marketplace, and for the first time, technology is going to work. A lot of smart money, a lot of smart people in this market, and it's the most disruptive time in our recent history. I've been in the employee benefit business for probably 30 plus years, and father of 6 and grandfather of 4 will be a testament to that. But tremendous change taking place, and our role is to try to help this market understand what that change is and be the place that the industry can come to and find information and connect with each other, because the key is collaboration, connecting with each other to try to help figure out where we're going and what can be done in the most effective way. And so what are some of the drivers to this disruption? The first is consumer-directed health plans. Started in 2002 with the development of the HRA, health reimbursement accounts, and health savings accounts. And we've seen this grow, now to about 15 million. These numbers need to be updated, but 15 million HSAs. But it took us 11 years. If there's 160 million, individuals covered by employer-sponsored health care, it took us 11 years to get to 15 million HSAs in place right now. Still a lot of positive growth there, but a lot of opportunity ahead. But this is probably the most dynamic change that is taking place in the marketplace. We all talk about healthcare.gov. You heard a lot about it, this morning. It provides alternatives for individuals. It provides alternatives for some small businesses and mid-sized businesses to move their subsidized employees there. But there's an explosion taking place in the marketplace with private exchanges. And private exchanges that have excellent solutions for not just the larger companies and the mid-sized companies, but for the small business. It may be a self-funded exchange. It may be an individual exchange or a small group exchange. And with the predictions here, and we're on track to hit these numbers, it's projected that there will be 40 million participants in private exchanges, employer-sponsored private exchanges, by the year 2018. If you draw that comparison to taking 11 years to get health savings accounts, you can see where this market is going and the tremendous growth. But this is where technology is moving in to serve a role to provide an employer a solution to let their employees choose the benefits that they wish to have for themselves and their family. The one other element is that it's proving that in exchanges, both healthcare.gov and the private exchanges, that consumers are buying down. They are buying down to an HSA and high deductible plan. Now, there'll be some mistakes that families will make because as they're just becoming educated, but what we're finding out early on is they're buying down because they're buying the right coverage the way it should be. In other words, to protect you from risk and catastrophic coverage, but we don't need $1 coverage. We never needed $1 coverage. That's where the cost got out of control. So consumers now, since it's part of their money, they're buying down and choosing the right coverage and surrounding that with other solutions like supplemental health and very creative supplemental health products and other products coming out to help those families manage the risk for their family and then manage the health. What we're going to see with private exchange and what's going to spur the growth, as I put up here, is that people are just now beginning to understand it, both the employers, the brokers, advisors that are offering the solutions. And so we're going to see advisors, employers graduating from what an expert in the industry, Jeff Yannick at Meister Health said, graduating from private exchange schools. We're going to see the models maturing. The exchanges themselves, we're still at the beginning. Clint Jones, the CEO of Go Health, which is one of the leaders in the individual health exchange market, said at one of my conferences in November, we're just beginning. Although some of the players have been in this industry for 3 to 5 years, the big ones, Aon, Mercer, et cetera, we're just at the beginning of private exchanges. So the platforms themselves are going to develop and mature. The support system behind them, the product mixes that go into them. And it's all very exciting because this is really where the industry should be, putting technology to good use. But it's not just the private exchanges that are evolving. I mean, we've got things like telehealth services, whether you see Doctor on Demand or Teledoc or MD Live, these names might not mean anything, but telehealth is evolving and other access alternatives. And telehealth, when it first came onto the scene, everyone said, well, telehealth, is that going to cause people to avoid care? Well, what we're finding out, it's enabling people to get better care. People are more liable to pick up a phone or go on video than to run to the emergency room, which A, is costly, and B, the majority of us want to stay away from walking into the doctor's office. So you're seeing these telehealth services mature and grow and provide really quality access to a majority of the population. A lot of emerging decision support tools. Again, we're asking consumers, meaning employers and all of us, are asking consumers to go make healthcare decisions and benefit decisions by themselves for the first time. Pretty complicated process. If any of you ever went to healthcare.gov as an example for the first time, pretty complicated process, let alone going into a private exchange and a company saying, here, we're going to move to a defined contribution plan. We're going to give you this allowance. Now go shop for your benefits and your health care. And you hear this silence. I'm going to do what? Shop for my health care. So we're seeing the emergence of a lot of quality decision support tools that help you make the right plan decisions for your family, that help you make the right health decisions, that help you find the right care at the right price, where you can go and access and compare MRI services in your area and not only find the right price, but what most consumers and others are finding out is you find better quality. And this is all going to even out the market eventually, because consumers are going to, since they are obtaining the power, you're going to see tremendous change come into the marketplace over the next 2 to 3 to 4, 5 years. A lot of management platforms. This is more for the larger mid-sized companies and larger companies coming in to help. You're asking an employer to provide multiple choice of benefits. Well, that sounds pretty good. How are you going to help me, the HR and benefits team, manage all those choices? Well, technology is coming in to help manage that. Not only the private exchange, but other enterprise healthcare technologies. The emergence of transparency tools and engagement. Engagement is key. If we're going to educate consumers and help them make the right choices, then we need to get them engaged. If we're going to help them become healthier, we need to get them engaged. And that's a common theme, and you're seeing technology play a role with engagement. And employee wellness, it's a much talked about topic, particularly up in the mid to larger companies. Wellness did not work in a lot of ways. It took a big knock on not fulfilling ROI. But today, it's having a reset. It's not going away. It's having a reset because most organizations, small, mid, and large, understand that if you can help your employees become healthier and help your chronic care employees better manage that chronic care disease, because it's not just about the healthy, it's about the entire population, that you will not only bend the cost curve in a positive way, but you will improve productivity and performance in your organizations. People will feel better about themselves. They'll feel better about the company that they're working for. And these are not just soft numbers. The These are hard numbers, but technology is coming in here and playing a big role, from gamification to wearables. You know, I have on my watch here, I have on my hand a very powerful wearable that's an analog. It actually was created by a company in France called Withings, and it's made for we baby boomers who don't want to, you know, wear a Fitbit, and it's an analog, but it's attached to a very powerful computer in my pocket, and enables me to not only track the steps I'm taking and keep me accountable along with my teammates, but in real time to measure my heart rate, connected to a very sophisticated scale, which helps me track not just, you know, my weight, but the CO2 in my house, and many, many other elements. And this is the tool that's emerging. It's a very powerful sensor and powerful computer. And this is where everything's going to reside in the future, and enable you as individuals, not just small business people, to sit in your doctor's office and ask the right intelligent questions. Now, the scary part is you'll be able to ask the intelligent questions. The doctors are going to have to get up to speed on how to answer those questions. I had a good friend of mine who just went through hip replacement surgery. He's a thought leader in this marketplace, and he gave a real life example. He knows what to ask, and when he started asking the providers, they didn't know how to answer his questions. It was like, wait a minute, we're telling you what to do. Why are you questioning what we're telling you what to do? So that's the dynamic change taking place too. Why the providers, you know, are catching up to consumerism. The health plans, you know, Brett talked about the change in health plans. I also think there's an opportunity for new health plans to come into this business. You got a very successful plan in New York now moving to California called Oscar Insurance. I think you're going to see more of that. You're going to see a consolidation from some of the traditional health plans, but you're going to see some alternatives, you know, pop up in the marketplace. So wellness, management of your health, putting the power in your employees' hands to really manage their own health, to manage their healthcare decisions, and the convergence of really smart people and smart money in this marketplace. You know, technology has been around this market for a while, but not at the degree it's here today. And there are a ton of smart people, and over $6.2 billion have been invested in health and healthcare in the last 18 months. That's a significant, significant investment in this space by some pretty smart people that see what the opportunity is to cause this transformation to accelerate and take place. We consumers, all of us are consumers, whether we run businesses or run benefit plans for a business or advisors. We're all consumers. And we really like choice, and we like to have control of our lives. And that's what's proving out. It's not always easy. You know, Todd Berkeley, who's a friend of mine and an expert in the HSA marketplace, advises consumers, and employers will call him in to educate, you know, the employee population. A lot of times they go kicking and screaming into an HSA high deductible plan surrounded with good wellness and surrounded with a lot of these products that I'm talking about. But 6 months later, they thank the company they're working for. They feel good about the decisions that they're able to make and the plans that they have. The other dynamic is, as we move to more defined contributions, similar to defined 401k, except healthcare has a lot of different dynamics. You know, when you tell your employee population, particularly if you're a mid to large company, that I'm going to give you $9,000 to spend on benefits, the reaction a lot of times from the employee population is, that's a lot of money. Is that what you've been spending? And so you have a residual, you know, effect coming back from employee population where they actually feel better about the benefits you're providing, and you, the employer, are able to fix a cost. So you're able to control your expenses better, but your employees feel better because most of us who have ever gotten a total benefit statement before at the end of the year about, here's your total compensation package, including your benefits, What do most of us do with it? Probably throw it in a trash can and don't even read it or don't understand what it says. But when an employer is giving you, the employee, money and a place to go that has wide choices, the employee and their families feel good about it. As long as the employer understands that the heavy lift, the first 3 years of moving to a program like that, is going to require tremendous education and communication between the employer working with their advisors, working with their health plan, working with other constituents to really educate. Because once those consumers are educated, and we're still early, they like the plans, they like the freedom of choice. So in this marketplace, I talk a lot about this, is that it's moving fast, it's disruptive, it's changing. You can ignore it, whether you're an employer, advisor, payer, provider, wherever. You can fight it, or you can adapt to it, because it's here to stay. We'll see where the ACA ends up. I think a lot of us in this industry on the ACA didn't want the law. The law's here, it needs a lot of fixing. We'll see about repeal and replace. But I think a lot of employers, particularly a lot of employers, really don't want repeal and replace because they're deep into it. They want changes. They want changes made to the law. So we'll see where that ends up. But consumerism is here. Technology is to play in this market. And I think as we move more to put consumers in control of making choices for themselves and their families on healthcare decisions and health decisions, the market's going to be much better for it. Thank you very much.